Thank you, Sarah. Thank you, Ben. And brilliant that you did this interactive format. I absolutely love the Q&A that you set up. So and thanks for your wisdom on the topic, Ben. I'm sure people. I've got questions anyway. So let's start the Q&A actually. So question for Ahmed. I mean, Holly's obviously had to go to another meeting, but Ahmed, one of the questions that came in on the chat was from Amanda Johnson. It related to the maternity app or the app, maybe the pediatric app, and how it links up with health visiting services. So the real strength of the app, and probably the difference between the app and the website, is the website is a repository of information, and although it's got wonderful functionality and layout, the app allows integration into provider systems. It could be maternity in terms of the PEDS desk, it could be NHS 111, it could but where are we at with things like primary care and health visiting? Is that a vision that you have for the app?
Yeah, absolutely. I think that's actually what very much the next stage, because what we want to do is, I mean, we talk about patient adoption and engagement as well, but in order to actually achieve that, we need to make it easy for them. So that it needs to be a carrot in it for the patient as well. And in our case, it happens to be that if you do strike amber, or if you do have genuine red or amber symptoms, then you actually get care as quickly as possible. And that's the mission of the NHS as well. So what we want to do is actually build those integration channels. And our current focus happens to be the pediatric desk, so that instead of a roundabout journey of going through 111 out of hours and then be referred either back into primary care or into the PEDS desk, we actually streamline that and go straight through. There's also been discussion, I'm not sure if Alex is actually on the call from Frimley, but there's discussion of integrating with online triage tools, because that's actually what primary care uses at present. So instead of practices having to monitor two different places for a request coming in, can we actually feed those requests into the channel which they're already monitoring? So those are the two areas which we're actually looking at. The health visiting team would be a natural progression of the same.
Thank you, Ahmed. Really encouraging to hear that that vision of integration is part of the app actually. And now that's a question or two for, I think, a collection of Jamie, Sarah, and Ben. So this concept of dipping one's toe in the water, I think, is where we see ourselves with AI. And although Ben, I totally appreciate that the operational stuff is the low-hanging fruit. We're just rubbish with operational stuff in the NHS, and yet we've got such a massive workforce that whenever we mess it up, it just causes such huge amounts of aggravation, and it's so time consuming, and people leaving that. I can see bots being the way forward for not just the NHS, but we see it in banking and with anything whenever we want customer services. But let's talk about the sexiest stuff rather than the sort of clearly the slightly boring operational stuff, and that's where we as Healthier Together kind of see ourselves in terms of the innovation and the vanguard stuff. I think one of the bits, a couple of questions, and for any of you, which is where could you see us dipping our toe in the water with AI in terms of Healthier Together specifically? Number one. And number two is a bit about the data. I think it's from your slides, Sarah, Ben, and Jamie, it's clear that you need to have access to good data to train AI. If you don't, then you just get rubbish outputs from AI. And so data, and you've heard Ahmed and Holly's presentation about the app. We're getting some very granular data out from the app. And would one see us using if we were to move to a very clever, innovative way of using AI to help clinical decision making, would that probably integrate better with the app and the data we're getting from there in terms of dispositions, or with the website? So yeah, those are a couple of questions.
Brilliant. So I think, as I said, although the operational stuff does tend to be more boring, it is a good starting point. But if you're going to twist my arm for an answer on some of the sexier stuff, then I would say that AI-powered virtual assistants tend to be a great starting point, because they're not the most complicated AI projects. They're shorter. You can get up and running in a matter of weeks, really, and there's loads of use cases for them, whether they are with the operational stuff or whether they are more patient-facing, giving them access to better, more accurate information. And then they integrate very nicely with automation and robotic RPA, so robotic process automation, so getting bots to perform tasks for you. So I think that would probably be where I would see a starting point for more of a patient-facing, sexier use of AI.
I think the only thing I would add,
Yeah.
Sanjay, is, again, obviously we're not an AI company and we're looking at how it can potentially help us. But, one of the things we're looking at is in our build is around the search functionality within the website. And there's a lot of AI powered code and information that we can see that we're going to dip our toe in that way as a company and start with a project looking at including in the build some of these AI tools around search, which is only going to improve the user that uses the website on Healthier Together. It's not, I probably wouldn't put it in the sexy cap, but I think we're at the start of our journey, and looking at it, we're looking at how we can improve our processes and improve the offering that we can provide to you as existing clients off the platform. And I think that's only going to be a positive. And I think that as Sarah alluded to, using it and starting to use it. I've used ChatGPT a lot, starting to use it a lot more. I think the more and more we use these things, they just become more and more ingrained, and the more and more you start thinking about how other ways to use them. It seems to me the big bang approach just seems too difficult for people to comprehend right now. That's my own thoughts.
Yeah, no, I think that resonates with what Ben was saying. I think we've got to grab people, get them to trust this technology, and that probably is with the operational stuff. I get it, but I agree that kind of working on the searchability. These Healthier Together websites contain so much content that how we can offer that content in a more efficient way to users of the site, which predominantly the public, pregnant women, parents, carers, young people, and even professionals, I think is probably the way forward. And we're going to hear a bit more about that in the case studies later on, about the work we've done with IBM and how we might be able to take some of that forward. Well, what time it takes. One thing I was struck by as part of that project, Ben, was how much time it takes to kind of train the AI. And I think that that's something that's important moving forward, is a recognition that it's not just we've got an idea and the computer does the rest. The kind of AI bit just trains itself, because it just doesn't, does it? And you made that point very clear with the data. And often that data and the manual checking and everything comes from clinicians, others, and humans, and that's sometimes where we're a bit short. We're short of human resources, which is why we're so keen to move to AI. But it's not just a drag and drop into AI. It's a lot of work that goes up front, which is upfront time, which saves you time in the long run, one hopes.
Yeah, I think so. And I think if you can emphasize this to more and more people, that they'll understand that the need for good quality data and the importance of inputting their data accurately, if they understand that it's got knock-on effects down the line.
Yeah, no, very good. And Ahmed, a question for you, actually, thinking about you described two apps. You described a maternity app, which Holly spoke about, which clearly has got extraordinary uptake. When you look at that uptake rate of close to 100% for pregnant women in Hampshire and the Isle of Wight. Then you described a pediatric app, and although you showed some data on what parents would have done if they didn't have access to the app, I didn't quite catch the data on what they actually did do, and whether that reflects what they would have done without the app, or whether it reflects a lot more green. But how do you see these two apps, which sort of target different populations? How do they interconnect? How do we achieve some of the great outcomes we've got with the maternity app and the pediatric app, which I assume doesn't have the same level of uptake amongst parents as the maternity app does?
Yeah, so we as a company actually spend a lot of time on design. So, user experience design is actually something which we put a lot of effort in. We, as you're aware, we have actually conducted user research as well to try and understand patient behavior. So one of the things which we've actually tried to do was, when the maternity project came along, we said we're actually going to try and align with the existing experience of the pediatric app as far as the user is concerned. We don't want to reinvent the pathway, the design patterns. It's about essentially saying, you do not put square wheels on a car. just for the sake of being different. If there's something which is a proven model, you stick to it. And we already have that engagement and evidence that patients were actually finding it easy and useful. And I think that's actually why it has been so successful. It's actually keeping it simple. And I understand, there's really interesting discussion around AI as well. And I've been actually part of this from a very from a long time as well, having coded some of the algorithms within AI myself. But I still very much remain cautious of its implementation within the healthcare setting as well, especially when it comes to our patients. I think keeping it human is actually what has worked to our advantage. Is that Healthy Together the app in particular is seen as a decision support, as opposed to actually providing an AI-based response to patient concerns. So I think by ensuring consistency between the two aspects, and after post-pregnancy, the natural progression into pediatrics, is how we've actually tried to keep the two things together and providing an integrated environment for the two.
Thank you, Ahmed. Very good. And last question is something that Emma Lim has put in the chat, which I think is an extraordinarily difficult question to answer, but we'll ask it and see if anyone's got any thoughts. We're almost awash with data in the NHS. We've got so much data in it, none of us can actually access any of it because it's all held in different places. Who unlocks that? Is it IBM have clearly got the tender for some of the NHS app stuff, must have access to some of these data sources. How do we pull this together so that we can actually train our AI more effectively? Maybe Ben, I'll get you to answer that one.
Yeah, cheers. So I'll start by saying you're not unique as an organization in terms of having loads of data but not actually being able to use it all because it's in different places. And so that's why I said that the start of an AI project and the foundation of an AI project really is collecting that data, and that is a time-consuming process, collecting it from various different places, and then organizing it before you can use it for AI. And of course, there are some tools that enable you to do that, and sometimes it's a change of process that might be needed. So some data is stored kind of in notepads from doctors writing things down, and if you know that you're going to need that data for AI, then perhaps you'll need to implement a change of process and start collecting that data in a different way.
And let's say that you've been working kind of with the NHS for the past 3 years, and we know where those data sources are. There's SUS data, there's primary care data that are held within primary care settings, there's microbiology data, there's UKHSA data, there's local authority data. But what efforts are being made by AI, by technology companies to access those data, and are we getting close to being able to, companies like IBM being able to access these various disparate sets of data in order to actually achieve some of the things that are potentially achievable?
Yeah, I think we're definitely making progress there, and certainly from sort of collecting data from disparate sources. A lot of companies, not just the NHS, have these challenges. So technology companies are looking to invest in tools that help you collect data from these different sources that are difficult to share data from. So I think we are making some progress there, but I appreciate that it is a challenge, and there's still a long way to go.
No, that's brilliant, and that's very encouraging for all of us on this conference to hear that progress is being made. I also appreciate the comment you made earlier, which is, if you start off with the operational stuff, you're not falling foul of some of the GDPR rules and the privacy rules, and all of that does get obviously very complicated to share data in a way that maintains those 5 pillars of integrity of AI and responsible AI. So I think on that we'll probably call this session to a close. We've run over by a couple of minutes. I want to once again thank all the speakers, Ahmed, Holly, Ben, Sarah, Jamie, for just a brilliantly interesting, thought-provoking session.